I'm Gary White for Channel 6, Central Kentucky Television. I'm here with Dr. Johnny Isaacs with Isaacs Isaacs General Dentistry in Springfield. And today we're actually going to take a tour of your office, something new and different for us, right?
Yes, we've been trying to do this for the last few months. And every time we have a Friday afternoon schedule, which I don't see patients on Friday afternoon, something comes up and I've had to cancel. So today we thought we'd like to give you a little tour of the office and show you some of the equipment that we use. Some of this equipment is intimidating, so it's noisy. So if you're sitting out in the waiting room, sometimes you hear something turned on and it sounds really loud. I thought I would go ahead and show people what it is so that you can kind of get used to the noises and know what it is. And we'll go back to, my plan is we'll start off in this room and probably go to several different rooms and show you some of the lab techniques too.
That sounds great.
Yeah.
So today we're starting out in an exam room, is that right?
Right. Well, this is it's called an operatory. So we can do exams here. We can do operative dentistry. Operative dentistry is essentially just a restorative, and I do extractions. Really anything that's associated with the dentistry, I do it in this room. The hygienists have their other rooms in the back, and I'll show you those too in a little bit. Now, in this exam room, or sorry, the operatory, which we can use as an exam room, we have the chair, the dental chair, and these things. Of course, they're electrical and have many different options as far as laying the patient's back. And most dentists now will lay the patient back and do the restorative dentistry in a reclined position. So that is that one. Of course, this is called the cuspidor. A lot of dentists do not use these anymore. When I came back here 30 years ago, 28 years ago, my dad had them, and I got accustomed to them, and I like them. So the chairs that I have now, I always include a cuspidor on there. It's a little spittoon that the patients can use for their comfort, so I like that. This is the X-ray tube. This is for a single shot X-ray. These things are very durable. This is one that we brought from our old office back in 1989. We moved out here, so it's been, this was probably purchased in '84. So we brought it back here. So we have two of these X-ray tubes, and these are the ones that we take the tiny X-rays of your mouth, the single shot or bite wing X-rays that you'll see sometimes. And this little thing here is called a cone. The X-rays come from inside they're encapsulated inside this lead. They're shot through here, and this cone will direct the beams in a straight line. Sort of like if you had a flashlight. If you had a light and you shine the light, it would go all over the room. But if you have this cone in here, it concentrates X-rays in a beam and it shoots them in a straight line, so that it's a lot safer. So all this, years ago we used to scatter the X-rays. Since I've been practicing, we have not been scattering the X-rays for 30 years. And so that's why we always had the lead apron on to protect the patient and really protected the dentist. We would always leave the room, to run away from the X-rays. But now with these cones, we're not projecting as much radiation as we used to in the past. So it's really not that big of a problem. Matter of fact, I think the stats are, it used to be that 40 X-rays were equal to about 3 hours out in the sun. Now it's 400. So with this new tech, some of the new materials that we use, so it's kind of a neat thing. So that's what that is. Now, if I turn around here, and I'll show you the television in a second, or the monitor up here, what the X-rays look like and how we can enlarge them and show the patient what's going on. And it's a very good tool to show the patient what they have. Before, we used to have these little tiny X-rays. We'd hold them up to light, and it was almost wizardry that we'd look at it and show the patient what was going on. We'd say, "Do you see that little spot up there?" And of course they couldn't. I could barely see it myself. But now we can make it as big as that screen, so it comes in very handy. Of course, everybody knows what this thing is. This is a handpiece. You guys call them drills. We call them, for euphemism, we call it a handpiece. And you push the rheostat, it comes on, air comes out, generates the turbine. As a matter of fact, these things go at about 100,000 RPMs, which is incredible. It's called a high-speed handpiece. High speed being 100,000. The low speed, this is a low-speed handpiece, probably about 4,000 RPMs, and you can also gauge them down. You have a torque reducer that you can put in here and gauge it down to to next to nothing. You can have it spinning very, very slowly, which is what we use for root canals. On root canals, we use a handpiece that goes very slow, maybe about, you can get it down to about 40 RPMs. Sometimes I'll use it at about 300 RPMs. So let me show you this. Gary, if you can, I'm going to come around here, and I've got JT, our cameraman, today.
That's right.
JT's been doing a good job for us all summer long. Even over. Right. That's right, you did work during the winter, too. Hey, okay. Now... can
we bring that around here so we can we're going to bring around our screen here so we can kind of show you the x-rays, right?
These are the x-rays that we were showing. It was taken from this camera right here, this x-ray tube. And if I click on that and enlarge it, you can see how big we can get it. So now the patient can actually see exactly what's going on. And JT, this is my son JT behind the camera. This happens to be his mouth because I knew he wouldn't care if I showed it up here. This is the crown that I did, I don't know, a couple of years ago, I think, and these are some of the fillings that he had. So this is a cap or a crown that we call, and of course there it is. That's how smooth we want the margins to be on this thing. So as you can see, he had a cavity over here on this side. That big dark spot is a cavity. So even the dentist's sons and daughters get cavities, so it does happen. Sorry about that, big guy. Just had to. Now this was this right here, the X-ray. I think that was probably somebody's finger from an accident or something. Was that mine or yours? Do you remember? Okay. All right. He won't talk to us now. I don't blame him.
Behind the camera, he's keeping quiet. So also in the middle of the tooth there, is that the nerve that you're seeing kind of go down there, the darker part?
Yeah, right here. This is the nerve inside the tooth. That's called the pulp chamber. Okay. And then you have the canals branching out down in here. So that's what that is. So if you do a root canal, you come in, you tunnel down through the tooth and take the nerve tissue out. Now, if I do this, right.
And that's the part that gets painful if the nerve gets really hit, right?
The nerve, yeah. Now this is called a panorex. This is JT also, and right there is the panorex. These are wisdom teeth. He's got 1, 2, 3 wisdom teeth, and we may have gotten the other one out. I can't remember.
Something to look forward to there, JT.
Well, a lot of people, we are losing our wisdom teeth over time. Take with it whatever you want to out of that, but JT only has 3, it looks like. So this is a panorex. We use these daily. Matter of fact, I would hate to practice dentistry without having a panorex handy. Mm-hmm. You can just see so much information. And when we take one, we screen from ear to ear is what I tell people. We go this is the external auditory meatus right there, and you go all the way around here, and here's the other one on the other side, and it just has a wealth of information. So we can see a lot of stuff.
Now, do you use the same X-ray device for that?
We have a panorex, and a ceph in the back. I'll show you that in here in just a second. Now this is our nitrous oxide machine. So and we use this probably about several times a week. Generally, we'll use it on children, any kids from 4 to teenagers, and really adults too if they want it. We'll hook it up, but primarily I use a lot on children. Like we bring the children in early in the morning, about 8 o'clock in the morning, and before they've had any breakfast, before they're still rested, and the worries of the day hadn't stuck up in their brain yet, and we kind of go ahead and try to do the dentistry. So I think that's about everything out of this office. We got the handpiece and everything. So
this is one of the rooms that's at the Isaacs Isaacs General Dentistry. We're going to continue our tour here.
Let's do it.
Okay, now we're in room number 2 here at Isaacs Isaacs General Dentistry, and we're going to take a tour of what this room has to offer. And what's this room called?
Well, this is a hygiene room. This is our room number 3. We call it number 3 just because we have 2 operatories, and this is number 3. This is where Sam Tingle does her propies, where she does her hygiene treatment. And what the hygiene is, of course, everybody knows that's a cleaning, but it's so much more than that. When Sam gets in there, she's doing a thorough exam on the patients. She and Elaine Taylor, and they can also take the x-rays. We showed you the x-ray tube in the other room. This is another x-ray tube. This is one that we purchased. Actually, we purchased from Dr. Dooley. Dr. Bill Dooley retired a few months ago, about a year ago, and we purchased his x-ray tube. So we got that. We had another old one. We got rid of that, and we got this one. So it's worked out very nicely. So and what Sam can do is take the bite wings, and this little device here, if you remember years ago, a lot of dentists used those little films that I told you that we held up to the light and you could see it. Now this is the sensor. This is an X-ray sensor. And what this does, you can put a little sheath on it, take the X-rays through it, and it's reusable. We reuse it on every patient, but we use a sterile sleeve on it in order to keep the bacteria levels down. And when we do that, the X-rays are detected by the tube and they can be shown on the monitor, and that's what we'll do. And we can actually move the monitor. We can, if she takes an X-ray in this room, she can show it to any room in the office. So I don't actually have to come, but I do because I'm nervous just by habit, by my nature. So I'll get up and kind of pace around anyway. So I'm always in and out of the rooms. So that's not a problem. So, but this is I kind of joke around and call this my truck. The reason is these things are very expensive and it costs more than my truck. So I want to instill upon the girls that, hey, be very careful with these things. So if you drop them, they can be damaged. So watch out for the truck.
That's right.
So now, whenever she's not cleaning teeth or doing her prophies, another thing she can do in this room is a zoom whitening light, and this is a light that intensifies the bleaching gel. The bleaching gel that we put on the teeth. She'll actually coat the teeth with the bleaching gel. Use the light, the high intensity light. It has several different options on it, and generally people want the highest intensity you can to get the best results. So we'll go ahead and increase it. And of course, I don't want you to swing around, JT, but we had just purchased another one in the corner. This one is going to become obsolete soon, so we have another one that we're going to go ahead. It's supposed to be better than this one. So this is the next generation's in the corner, and we'll get that going soon.
Even whiter.
Even whiter, brighter, lasts longer, we hope. Another thing that high-pitched, if you've ever had your teeth cleaned, there's something that's very high-pitched. It's almost like a squealing sound. That is the ultrasonic scaler that we use, that the hygienists use, and I don't have it turned on right now, but it's this little thing. It's got a wand, and you put the working end into the wand, and this little tip will vibrate at a very high frequency, higher than the speed of sound. The frequency is higher than sound, so it's supposed to be ultrasonic. So, so that's what it is. But
is that clean?
Yes, but of course it is sonic. Sometimes you do hear it squeal down, but the vibrations are ultrasonic. So this is called a Panorex. This is the Panorex. It shows the ear-to-ear film that I showed you in the first room, and this one you can see all four wisdom teeth. You can see the entire mouth, and this is what takes the X-ray, the film. Well, I keep saying film because years ago we used to use film, but now we use sensors, so it's all computerized and digital. So what this does, the X-ray actually comes from here. So this is part of the tube. It comes out here and shines on this. If that was a truck, then this thing's got to be some kind of. It's more like my no. It's more like my Cadillac, I guess it would be. But this thing, the sensors are very small. On that one, this is a very large sensor, has to be that big, so that is what shines the X-rays to be converted into the digital format. So that's what creates that. And this thing will actually spin all the way around your head and get it. And it's done so that you can hold this like handlebars, and it'll kind of vibrate, or not vibrate, but rotate all the way around your head. Now, the orthodontist, I don't particularly use this very much, but I use this daily, but the orthodontists use what's called a cephalometric film, cephalometric X-ray. And what we can do is orient this tube to shine straight across here into another sensor that happens to be over here on this side, and you can take a ceph. A ceph is a straight-on picture of the face and teeth, so that the orthodontist can configure the jaws, and that's what they do. So that's this is a very valuable piece of equipment. Would not practice without it.
Okay, now we're in the lab that we're going to get a chance to see what this room has to offer for us, right?
What I'd like to show next, we're in the lab. Of course, this is kind of behind the scenes, but if you remember back in the early 90s, there was the HIV or the AIDS epidemic was rampant, and there was a big AIDS scare, and people actually wanted to come in and see the autoclave that we have in a dental office in order to sterilize instruments. This is another piece of equipment that dentists cannot practice without, and it's called the autoclave. Autoclave it's a sterilizer. It's a heat sterilizer. It uses steam heat in order to get. It uses water to create the steam in order to get enough pressure to get the temperature up to 270 degrees, and the temperature has to be that warm for 15 minutes. Let me kind of see what's on here. If it's 15 minutes for this is still pretty hot. This thing has been turned off now for about 3 hours, but it's still pretty warm. So these instruments in here are still sterile. When I look inside there's bagged instruments and there's instruments alone. The instruments that are alone have to be in there for 15 minutes, and the bag have to be in there at 20. So we put everything at 20 if there's a bag in there, just to make sure we get it all sterile. And I'll push that back in there. It's still very warm. So it just takes a while for it to cool down. Of course, it's got the rubber gasket on it, so we'll just leave it open in order to let it air out for a while. But
so once they're sterilized until they're used again now, right?
Right. What we'll do is one of the girls will take it. It's sterile until it's touched by human hands or until we get it contaminated. Of course, when I reached in there, I just pulled the lever out there and didn't touch it. So they're sterile instruments, and they'll be put away into some of these drawers. We'll rebag them and put them in drawers, and then the bagged instruments we will actually put them in here, and this happens to be the hygiene instruments, so they're bagged. They've already been run through the sterilizer, and then we'll put them up there, and that'll be used for a patient. So it's kind of the system, and each one of our assistants has been trained in it. Not only that, if somebody's busy or can't get to it, they all can run the autoclave, and that thing is going. That thing goes nonstop. Usually, as soon as we got a 20-minute cycle. Sometimes it'll take 30 minutes because it'll take 10 minutes for the steam to build up in order to get the pressure. As soon as that's over, something will be waiting to go in there again, so it's constantly moving. Sometimes we'll have two of these things going. Right now we just have one. And we have another one ordered, I think, right now. So it's called the autoclave. Right next to the autoclave, before we use the autoclave, we'll use the ultrasonics cleaner, and what that does, it vibrates at a high. Sure, it vibrates at a high frequency into this water bath, and you turn that on, you can kind of hear it vibrating in there. So we'll take some instruments, put them in there, and it'll vibrate for about 10 or 15 minutes. You can set this thing for an hour if you wanted to, but we set it for about 15 minutes and let it kind of vibrate some of the excess off before it goes in there. So what we'll do is, if you take a contaminated or a dirty instrument, the girls will bring it in here, scrub it under hot water, dry it off, put it into the ultrasonic bath, let that stay for about 10 minutes. Then we'll bag it and put it into the autoclave. So it comes out, they're sterile. And of course, sterile means there's no bacteria associated with the instruments at all. If they're sanitized, they're clean, but sterile means that they're surgical sterile. Now, if we turn around,
so there's a whole process that goes on with each one of these.
So each patient, every time you see the dentist or the hygienist rip that open, that's what's happened to those instruments. They've been through all that, so they've been heated for 15 or 20 minutes at 260 degrees. And sometimes if I need a different instrument, they'll bring it in there. It'll still be pretty warm. So we have to run it under cold water sometimes just to cool it off to touch it. So that happens too. That's on one of those busy days that we really need something, and we're running out of instruments. Speaking of instruments, here these are some of the instruments that we use for the extractions, and you can see. I don't know if JT, if you can pan up there and see, but we have several different. I think there's 14 different instruments that we use to take teeth out. Most people just think there's one, but I'll be yelling if you've ever had a tooth taken out, or wisdom teeth. You'll hear me talk to the girls and say, "Get me a 150 upper, or I need a maxillary left physics, something like that." Well, that's where they come from. The girls come back here and get those, and sometimes they move pretty fast. Whenever something happens or a tooth might fracture, the girls will get up and come back and switch them out. And of course, once our rooms are not sterile. The rooms are clean. The instruments are sterile. So once the girls leave the room, they'll take their gloves off, come in here, pack the instruments, and take it back in there, and they'll have to re-glove. So it's kind of a cumbersome process, but it has to be done. So that is that. And then before that, this is another soaking solution. Yeah, this is a sanitizer. This does not sterilize in the back. That's for something that will be used in the room, but not actually inside the patient's mouth.
Okay. So there's a whole lot of stuff that goes into this.
A lot of stuff. That's why we're behind the scenes. You don't realize what's going on. So there again, this is where we start the washing process. These are some of the instruments that are sterile. We have the surgical instruments here, and then over here, this is what we make retainers with. And this is one of the louder things that we have. The retainers, if you've ever had braces or if you need a splint or some type of thing, we can make it back here. We've got we call this a suck down. Reason it's a vacuum. You turn the heater on. The heat comes down here, melts the plastic. You turn this valve vacuum on. You turn that vacuum on it, and it'll suck the plastic over top of the mold and create an identical mold of the teeth. And it's loud, so we always close the door when we use that, because you're in there working on somebody and they're nervous, and you turn that thing on, you can hear it all over the office. So we try to keep that down.
Doesn't help calm them down.
No, and you'll hear me say sometimes, go polish something, and the girls will get up and go polish it. This is our polishing wheel. This we just use rough pumice to polish crowns or something, or some little plastic thing that has to go in the mouth, and so your tongue doesn't play with it, and we'll polish it there. And these got to be sterilized and sanitized and changed routinely. Another thing we use, this is called a triad machine that we can use to make certain. If you've ever had a denture made, we use this a lot for different parts of the denture. We'll take an impression. The patient will leave, generally come back in a few days, and the next step would be either a second impression, or we'll do what's called a wax try-in, and this is some of the behind the scenes. We use that machine to do that. Another one, this is a dental, this is actually a drill. We don't call the other drills, the drill that everybody else calls a drill, we call that a handpiece. This is a drill. This is a lab drill, and it's got a variable speed device on it, so that you can turn it on and rev it all the way up, so that we can cut things. If it's something like something pretty tough that we know is going to cause a lot of noise, we'll take it out of the patient's mouth, bring it back here, actually do it in the lab, cut it in here, and the patient doesn't have to deal with that, because this can be kind of loud too. Yeah. Especially if you got something going on there, some kind of acrylic. Now, Mary Beth Pinkston has done a lot of work getting everything organized. About 6 months ago, this was nothing but just a cluttered drawer. She's got everything, very nicely organized. So this is some of the things that we use, and that's what would come out of here. This is some of the stuff we're working on here now, and this came out of the triad machine, this little blue thing. So that's how it goes, and we put it right here.
Okay, so they're the molds that you're making and stuff
underneath there. So it's out of. This is a vibrator that whenever we're pouring up models, you want to get all the air out of it, so it's very accurate. So you turn that on, then you get your plaster, and you pour it into the model, and it's got to be vibrated in there, and it's very precise. Every girl that's ever done this, or any dentist that's ever learned to do this, you're always going to make mistakes. It's just technique. You've got to practice it. So we've always got, we're kind of critiquing each other and grading each other and looking for bubbles, but it has to be exact, and that's why it's so difficult to get exactly right. And that is a model trimmer over here. I don't know if JT can see that, but that's what we trim it. That's loud too. I'm not even going to turn that thing on. We have to close the door so it doesn't scare everybody around here. So that's basically that's it, I believe.
And this is the lab down at Isaacs Isaacs General Dentistry. We've been getting a tour here with Dr. Johnny Isaacs, and if you want to come and experience Dr. Isaacs' technique here yourself, what number can they call to make an appointment?
The telephone number is 859-336-7680, 336-7680.
And where are you located?
39 Bobolink Drive in Springfield.
And again, this has been Isaacs Isaacs General Dentistry. It's Gary White here with Dr. Johnny Isaacs. And we had JT on the camera. Thank you very much.
Thanks, JT.